Now, in terms of the nostrils, there's sort of what I see, and I can really only talk for like my patients. Yeah, I mean, I see pictures of other people's work, and I see very similar, sort of effects with the nostrils in good hands. I'm not talking about everyone doing lip lifts, but in people who I respect as, good lip lift surgeons, it's the same exact thing. So in a fraction of patients, I'd say maybe about 10 to maybe 20% of patients, which is not a small number, there will be a little increase in the amount of like essentially black that you see on the frontal view, the amount of nostril show that you get, because as it heals, there could be like some degree of pull down from gravity, and so you could reveal a little bit more of the actual black part of of the nostril. That's possible. That being said, I've never had a patient actually complain to me about that. Even when it develops, I might see it in a picture, but they don't really even notice it. So it's not really something people complain about. I have patients who worry about all types of things, that the nose will be wider, that it'll be crooked. I've heard a lot of different concerns, but none of them, at least with the technique that I use, are very like grounded in reality. So that's something to keep in mind, that most of the things you hear about and read about, at least with the technique I use, aren't something that happened. But with the nostrils coming down a little bit, more nostril show, that's very real. That could happen. Most people are not bothered by it. The other thing is, again, there are different techniques, right? So I can just speak for my technique primarily, and other people who use a similar technique to mine. But there are people who make their incision at this sill level, they'll make it into the nose. So
Yeah.
they do that to hide it, right? So that's not as visible. But the problem is you distort natural anatomy. So this sill is important because it's like a little mound that separates the lip from the nose. We all have it to different varying degrees. Now, if you made the incision into the nose in that area, you've now obliterated that sill, because now you pull the lip, right? You cut out that skin, then you pull the lip into the nose, and the whole sill kind of becomes flattened and starts to look artificial. So you've hidden the incision, but you've also changed the architecture of the nose.